this all on my own. No, I know I'm no Superman. I'm no Superman.
The reason no doctor likes going to EKG testing is not the crappy food or the cocky jocks, but the fact that diseases like hypertrophic cardiomyopathy are so serious and so rare. Any little sign of a heart murmur, dizziness, or chest pain is a big deal.
Dr. Dorian, please report to the gym immediately. Dr. Dorian, please report to the gym immediately.
So James, have you been feeling any dizziness or fainting lately?
Yes, sir.
For how long?
It's been a while now. Over the summer I just blew it off because I thought I was dehydrated, but over the past year it's gotten bad.
Now, do you have any family condition of heart conditions, high cholesterol, heart attacks?
My dad, he passed away 5 years ago from a heart failure. I forgot what it was called. I think it was cardiomyopathy something.
Dilated cardiomyopathy?
Yeah, that's it. You really think I have a heart condition? I'm an athlete. I can't.
Well, actually 26% of young athletes die from hypertrophic cardiomyopathy. 1 in every 500 adults is hypertrophic cardiomyopathy. As far as the individual goes, it's a genetic disorder, so it usually can be found in people that have family history of heart conditions and stuff like that, but it doesn't affect by race or anything. It's just completely random. It can affect anyone from newborn to elderly, but it's usually found in people in their 30s.
You don't actually think I have it, do you? What are the risks? If I do have it, am I going to die?
Well, I can't tell if you have it just by looking at you, so you're going to have to come to the hospital and run some tests. But you could get seriously injured from fainting and life-threatening heart rhythm problems, heart failure, dilated cardiomyopathy, as your dad had, and in the worst-case scenario, death. But you might not have it, so stay positive. Dude, don't you want tonight? You can't go out with Carla.
What's tonight? We're gonna stay tonight. We're gonna eat it right. We're gonna stay tonight. It's just such a treat. It's the world's best meat. He's Cody. Let's go. Is he clear? Clear. Pulse doesn't come back. Clear. Woo.
Thank you guys.
You almost went into cardiac arrest.
Word. Hello, Miss James' mom. Thanks for coming in. I'm really glad we can have you here because your son is really bothering us with some of the symptoms that he's showing. Is there anything that we can help you with?
Yeah, I heard that my son was diagnosed with a heart condition similar to the one that my husband had died from. I don't want to lose both of them. Can you help me?
Well, everything's going to be alright, but do you need anything right now?
Yeah, I would like to know more about this heart disease.
Well, it is a genetic disease, which means your husband probably passed it down to your son. It is caused by mutations in the 4 genes that encode the proteins in the cardiac sarcomere. These genes are the beta-myosin, heavy chain, cardiac troponin T, atropomyosin, and myosin-binding protein C genes. They are all found in the actin molecules.
What my partner in crime Perry is trying to say is that the genes affecting the cardiac muscle tissue, or the muscle in James's heart, is making his heart bigger than normal. Now this could be from one of 2 possibilities. There could be a defect in the glycogen storage units, or you could have a defect in chromosomes 1, 14, or 15.
That can also lead to familial hypertrophic cardiomyopathy and involve defects in the protein kinase gamma 2, which result in familial glycogen accumulation cardiomyopathy associated with Wolff-Parkinson-White syndrome. Or you could have defects in lysosomal associated membrane protein 2, which results in Danon disease.
As you can see, hypertrophic cardiomyopathy has to do with an enlargement of cardiac muscle tissue, specifically in the interventricular septum, which is in between the right and left ventricle. This can restrict blood flow to the rest of the body when the muscle gets too large.
This disease affects our entire body because our entire body needs a constant blood flow, and any disease that affects the body's ability to have flow blood throughout the body will have a morbid effect on the person. All bodily functions and major organ systems that need blood will be affected by this disease.
Hello, Miss James' mom. I know that's a lot to take in, but it's really just a summary. If you want us to get into it.
No, sorry. I didn't know what you're saying. I lost you a while ago.
Okay, let's go, Diane. We gotta go check out the James.
How did he know my name?
Actually, he kind of calls me girls. It's a game, kind of.
He is a girl, so we'll just get out of here.
Hello, James's mom. Thank you for joining me in my office today.
No problem.
Could you explain to us how James has been feeling for the past few days, months, weeks?
Yeah, well, he was complaining about his chest pains, and he was really lightheaded, and almost like he was going to faint, probably especially because of football practice, and he had shortness of breath even when he was just sitting around, and he was breathing really heavily and fast.
Interesting. Those seem to be symptoms of hypertrophic cardiomyopathy. Could you tell us if he ever fainted?
Well, a couple times, but I always would, like, get back up again, kind of like if he was tripping or something.
Get dunked on by bearing hypertrophic cardiomyopathy! Well, HCM does affect the whole body. The main organ it affects is obviously the heart, but another couple organs that it affects is the brain, the liver, and lungs, all of which require blood flow. And since hypertrophic cardiomyopathy constricts its blood flow to these organs, they begin to break down and eventually not end up functioning properly.
This is James' mom. It's actually very lucky that we caught James' condition before something bad happened. Since he was in football, he's constantly at high risk of strenuous activity and therefore could suffer from heart failure at any time now.
Well, can it just be like a heart attack, something not as serious as hypertrophic cardiomyopathy?
Well, as you can see right here, heart attack is one of the most common misdiagnoses of hypertrophic cardiomyopathy, since both of them share the common purpose of constricting blood to different parts of your body. So many times when someone has hypertrophic cardiomyopathy, a doctor might just assume it's a heart attack.
Well, didn't my husband die of something different than that? Like dilated cardiomyopathy?
Well, not really. He died of a different level of hypertrophic cardiomyopathy. You see, as hypertrophic cardiomyopathy goes untreated for a very long time, it slowly begins to degenerate your heart muscles so they cannot pump blood as efficiently to the rest of the body. When this happens, your heart breaks down and it basically overworks itself. So you could say that dilated cardiomyopathy is basically one step higher and worse than hypertrophic cardiomyopathy.
Well, thank you for coming in, but I think that's all the information we need. Dr. Turk, Dr. Cox is waiting for us in James' ward.
I believe so. Let's bounce.
Are you or someone you know affected by hypertrophic cardiomyopathy? Does it affect every aspect of your normal life? Well, now there is hope. Now I present the drug, hypoflaxis.
Clinical research has proven with proper surgery and hypoflaxis you can live your life again.
Before hypoflaxis, I had a boring and obscure life. I had to stay in my house all day, and I couldn't really do things average people do. But now, I can just do things. Hi-ya!
Get Flexislax from any providing Big Lots, Bass Pro Shops, or PetSmart. Warning, hypoflaxislax potentially might not affect your health in any way.
Okay, James, we're going to discuss some possible treatments for you.
Dr. Turkleton, why don't you tell them some tests that we've helped run to help diagnose the disease?
Well, we first found some problems in your heart when we took the EKG at school. Then we brought you into the hospital and took a chest x-ray and an MRI of your body. Both showed inflammation of the heart.
And then we got you on a heart rate monitor, and then took an echocardiography, and we could get a moving picture of your heart to make sure everything's all right.
We've also been regularly using a stethoscope to help check for heart murmurs that you might be having.
Nicely done, buddy.
Thanks, buddy!
The goal of treatment is to help prevent symptoms and prevent complications. One thing we can have you do is stay in the hospital until you're ready to go. We can give you medications to help relax and contract your heart, such as beta blockers and calcium channel blockers. But really, we need to make sure you're all right before you can start doing strenuous exercise.
Another thing to do is put on a permanent pacemaker, but these are less used today. If your condition worsens and gets high risk, then we can do an implantable cardioverter defibrillator to prevent sudden death.
Final option is probably surgery. And if this were the case, we'd have to perform a surgical procedure called surgical myectomy to remove the thickened part of your heart so blood can flow out of it. But the patients that go through this procedure usually have better health conditions.
Oh, shenanigans, he's coding.
Oh, let this happen.
I like the sound of my voice.
Oh,
CPR. Clear. We lost him. Time of death, 9.
Wait, doctor, listen to this.
Listen to your heart when he's calling for you. Listen to your heart. There's nothing else you can